Hello everyone, I'm Lily from Peking University Health Science Center. Today what I'm going to talk about is ligament injuries of the knee. Let's begin with a small clinical case. A 22-year-old man named Peter was injured when he was playing basketball 2 months ago. He immediately felt pain in the left knee, and the flexion and extension of the left knee was limited. He was unable to walk and was admitted to the hospital with the help of his friends. In the hospital, he received a physical examination and radiological examination. Finally, he was diagnosed with ruptured left medial collateral ligament and anterior cruciate ligament. Reconstruction surgery was recommended. After the surgery, he went through serious rehabilitation training, and now he can play basketball again. According to the clinical case, you might ask these questions, especially if you are a sports enthusiast. What are the anterior cruciate ligament and medial collateral ligament? What is the mechanism that knee joint ligament injures? What are the clinical manifestations? What supplementary tests should be performed? How is it diagnosed? How is it treated? Well, clinical key student and complete anatomy can help us. With so many resources, Complete Anatomy is the most powerful anatomy software I've ever used. This is Clinical Key Student. As you can see, it has different types of information like various books and images. It's very easy and convenient to use. Now, let's get back to our talk show and see what information these two tools can bring us. At first, we have to talk about the anatomy. The knee is a complex hinge joint involving the femur, tibia, and patella. Moving the patella and patellar tendon away, we can see 4 important ligaments that can stabilize the knee joint. The anterior cruciate ligament, ACL, stops the tibia sliding anteriorly. The post-cruciate ligament, PCL, stops the tibia sliding posteriorly, contrary to the ACL. The medial collateral ligament, MCL, prevents Vogus instability. The lateral collateral ligament, LCL, prevents various instability oppositely. These 4 pictures are the gross specimen of the ligaments. What our patient Peter in the case got injured were the ACL and MCL. How can these ligaments get injured? Now we move on to the injury mechanism. ACL is the most vulnerable ligament, often ruptured in sports activities by a sharp twisting movement or by a tackle which pushes the upper part of the tibia forwards. A strong Vogus strain can also lead to the ACL injury, like this one. PCL will get injured if the tibia is forced posteriorly, especially when you are driving. Consistent with their functions, the MCL and LCL injuries are often caused by the Vogus strain and varus strain respectively. So these are the possible injury mechanisms of Peter. Knee ligament injuries are often associated with other ligament injuries or meniscal injuries. Have you ever heard of the Unhappy Triad? It's okay if you haven't. You'll find out later. The minute they tumbled, patients may feel something go immediately. They are commonly associated with an audible pop or snap. When there is an injury, there is always pain. Many patients present a long time after injury with symptoms of instability. They will be unable to play on, even walk, and may have to be carried from the field, like Peter. If the doctor does physical examination for the patient, he may find signs as follows: swelling, tenderness, and opening up of the joint. There are some special tests helping to determine whether the ligament was injured and distinguish which ligament was injured. This is the anterior jaw test for ACL injury, with the patient lying supine, the knee at 19 degrees flexion. The proximal third of the tibia is pulled toward the examiner. In an ACL disruption, the tibia moves forward excessively and there is no clear endpoint. Leachman's test is similar to the anterior drawer test, but with the knee at 20 to 13 degrees flexion. In a PCL disruption, the tibia is seen to sag back with the knee flexed at 19 degrees. This is confirmed with a posterior drawer test, in which the same posterior translation and lack of endpoint is demonstrated. Next are Vogus test and Vogus test. With the knee in full extension, push firmly medially and then laterally to stretch first the MCL and then the LCL. Abnormal movement suggests an extensive ligament rupture. That's all about the special tests. With the ACL and MCL injuries, what kind of tests do you think Peter are positive for? Please show me on the demo. It's quite necessary for the doctor to get information from the imaging examinations as important auxiliary ways, which include X-ray, CT, and certainly MRI. Plain radiograph gives us some hints of ligament injuries. In the majority of cases, a second fracture is associated with detachment of the anterior lateral ligament and tears of the anterior cruciate ligament. The black arrows refer to second fractures. CT provides more details, but it's not a must. However, MRI is very useful in confirming the diagnosis due to its high sensitivity. Taking all the things I've talked about into consideration, normally a diagnosis can be made, but still there are additional aspects I have to mention, which involve the history of trauma, the arthroscopy. Arthroscopy is the most reliable diagnostic tool, understandably, because the damaged parts can be directly seen. Treatment decisions should be individualized on the basis of age, activity level, instability, associated injuries, and other medical factors. Just a sprain or partial rupture of the ligament can be treated conservatively. Patients are asked to rest and treated for analgesia, usually combined with physiotherapy and immobilization if needed. Ligament reconstruction is required for the completely fractured ligament. I guess you guys may be interested in the surgery, so let's watch an animation video.
This is a treatment animation for a torn anterior cruciate ligament. It involves harvesting a portion of the hamstring tendons to create a graft that can be used as a replacement anterior cruciate ligament. A portion of tendon is removed from the semitendinosus and gracilis muscles.
Another autograft is Bowen patellar tendon Bowen autograft. Energetic tendon and artificial tendon can also be used as graft.
These tendons are then connected using a baseball stitch to create a strong graft. The damaged anterior cruciate ligament is removed and holes are drilled through the tibia and femur through which the graft will be passed. The graft is positioned and secured using screws and staples.
The last thing I want to emphasize is that do not miss out these combined injuries when you are treating patients. Now you get the answer to the unhappy triad. The unhappy triad refers to the injury that involves three structures of the knee: ACL, MCL, and the medial meniscus. It is named such because the athlete who suffers it typically becomes really unhappy. But at least we have the surgeries, right? That's all I want to share in my talk show. I really hope you enjoy it. You can recap a little bit of what I've been talking about today with the 7 summary cards. Thanks for your attention.